Welcome to Nurseslab. Fluid and Electrolyte Imbalances, NCLEX Case Studies for Critical Thinking, 2026. Welcome back to the channel, future nurses. Today we're diving into one of the most high-stakes areas of the 2026 NCLEX, fluid and electrolyte imbalances. This isn't about memorizing lab values. This is about clinical mastery, subtle cues, and rapid decision-making. If you want to sharpen your diagnostic instincts, you're in the right place. First, let's see about unpacking the labyrinth. Fluid and electrolyte imbalances are silent disruptors. They creep in quietly, but when they hit hard, causing neurological changes, cardiac instability, and rapid deterioration. The 2026 NCLEX expects you to recognize these patterns early and intervene with precision. Today, we'll walk through two high-yield case studies designed to challenge your clinical reasoning and elevate your practice. Let's start with a diabetic patient presenting with severe dehydration. Here's what you observe: dry mucous membranes, tachycardia, heart rate at 118, blood pressure of 92/54 millimeters of mercury, confusion, sodium at 150 milliequivalent per liter, glucose at 420 milligrams per deciliter, urine-specific gravity of 1.035. These findings aren't random, they tell a story. Can you guess what the story of this patient is? Okay, let's see now. High sodium and high glucose point toward a hyperosmolar state. The confusion signals early neurological compromise, and that elevated urine-specific gravity, the kidneys are desperately trying to conserve water. This patient is on the edge of hypovolemic shock. So, what is the priority actions? Your first move is to restore perfusion. Start isotonic fluids, that is, normal saline, and reassess frequently. Monitor mental status, urine output, and hemodynamics. Once fluids are underway, you prepare for insulin therapy. Correcting sodium too quickly risks cerebral edema, so slow and steady is the rule. This is the kind of layered reasoning the NCLEX now tests. Next, let's see about hyperkalemia's hidden dangers. We see a patient with chronic kidney disease who arrives with muscle weakness, paresthesias, and an irregular heartbeat. Labs show a potassium of 6.8. The ECG reveals peaked T waves and a widened QRS. Now look at the medication list: ACE inhibitor, spironolactone, NSAIDs, a perfect storm for hyperkalemia. From this given case, what you must recognize: this isn't just a lab abnormality, rather this is a cardiac emergency. Your priority is to stabilize the myocardium. That means IV calcium gluconate. Next, shift potassium back into the cells using insulin with dextrose. Prepare for additional interventions like sodium bicarbonate or dialysis, depending on the patient's condition. And remember, ECG changes always outrank lab values in priority. Next, we are going to see about anticipating deterioration and rapid response. Fluid and electrolyte imbalances can deteriorate fast. Here are the red flags that demand immediate escalation: sudden drop in blood pressure, new confusion, irregular heart rhythms, rising potassium, urine output under 30 milliliters per hour, seizures, respiratory distress. If you see ECG changes with hyperkalemia, altered mental status with sodium shifts, or signs of shock, activate rapid response. In this scenario, let's see how we'll apply SBAR with an example. Communicate clearly using SBAR. For example, patient with potassium 6.8, peaked T waves, CKD, and irregular rhythm, request immediate cardiac stabilization. This is how you advocate effectively and save lives. Mastering the NCLEX 2026. The NCLEX is evolving, and so must you. Expect more case clusters, more lab trend interpretation, and more emphasis on clinical judgment. Your success depends on recognizing patterns, prioritizing safety, and anticipating complications before they occur. Fluid and electrolyte mastery isn't just exam prep, it's essential for safe, confident nursing practice. Stay sharp, stay curious, stay ready. If you found these case studies helpful, hit like, subscribe, and share this with your study group. Drop a comment if you want a full NCLEX practice set or more case-based breakdowns. Your journey to becoming a clinically sharp, confident nurse continues, and we are in Nurseslab here to guide you every step of the way. Thank you for watching. See you soon in our next video.